In this video, I'd like to tell you about eye surgery. In 1948, Spanish ophthalmologist José Ignacio Barraquer Monner was fed up with glasses. He wanted a solution for blurry vision that fixed the eye itself, without relying on external aids. But the surgery he eventually devised was not for the faint of heart. Barraquer began with slicing off the front of the patient's cornea and dunked it in liquid nitrogen. Using a miniature laser, he ground the frozen cornea into the precise shape necessary to focus the patient's vision. Then he thawed the disc and sewed it back on. Barraquer called this procedure keratomylosis, for the Greek words for cavern and cornea, and thought it might sound grisly. His technique produced reliable results. So, how did Barraquer's surgery work? Keratomylosis corrects what are called refractive errors, imperfections in the way the eye focuses incoming light. Ideally, the cornea and lens work together to focus light on the surface of the retina, but several kinds of refractive errors can impair this delicate system. In people with myopia or short-sightedness, a steep cornea focuses light just short of the retina. Those with hyperopia or far-sightedness have the opposite problem. Light is focused too far beyond the retina, and in people with astigmatism, the cornea has two different curvatures which focus light at two distances and produce blurry vision. Even those with perfect vision will eventually suffer from presbyopia or aging eyes. As the proteins in the lens age, they slowly increase its size. By an adult's mid-40s, the lens is too large to easily change shape and shift focus. Glasses and contact lenses bend light to compensate for these refraction errors. But as Barraquer's procedure shows, we can also alter the shape of the cornea itself, moving the focal point backwards, forwards, or pulling it a divided image together. And thankfully, modern eye surgeons can sculpt the cornea with far less invasive tools. In corrective laser eye surgery, surgeons rely on excimer lasers. These tools are accurate enough to etch words into a human hair. To safely accomplish these ultrafine incisions, they use a technique called photoablation. This allows the laser to essentially evaporate organic tissue without overheating surrounding eye tissue. So, how does laser eye surgery actually work? The first step is to separate a thin layer from the front of the cornea. This can be done with either a flat white blade or a thermosecond laser that produces millions of tiny plasma bubbles to create a plane beneath the corneal surface. Surgeons then lift the flap to expose the inside of the cornea. Guided by the refractive error and the shape of the cornea, the excimer laser robotically sculpts the exposed corneal band into the correct shape. This process usually takes less than 30 seconds for each eye. Finally, the flap is closed and its each reseal themselves in just a few hours. Because the lasering is done on the eyeball itself, it's described as in situ or on site. Its complete name is laser in situ keratomelicus, but you probably know as it LASIK. Essentially, this technique carries a patient's contact lens prescriptions onto their cornea. Like any surgical procedure, LASIK comes with certain risks. Some patients experience slightly blurred vision that can be corrected by glasses. But the technique is currently about as likely to damage your eyes as wearing daily disposable contact lenses for 1 year. Today, a technique called SMILE enables surgeons to sculpt the cornea through even smaller incisions, further reducing recovery time. And lasers aren't just recording the three types of refractive errors. This technology can also restore aging eyes. In a technique called laser blend vision, surgeons adjust one eye to be slightly better at distance vision and the other to be better to close range vision. The difference between the two eyes is small enough that most patients can merge their vision, allowing both eyes to work together at all distances. Advances in laser technology continue to make vision correction surgery more effective and assembly. One day soon, Berger's visions on a world without glasses may finally come true. Thanks for watching.